Start.
Hello, good afternoon, good morning, everybody. Blair Hannawalt from SEMA Reproductive Health will be starting in just 1 minute as we wait for people to join. Thank you. Great. I am going to jump in now just to get us started. Hi, everyone, again. Thank you for joining this webinar. Right away, I want to mention that we have translation. So if you go to the bottom icon, there's a globe, and you need to pick English or French for your preferred language. My name is Blair Hannawalt. I am Executive Director for SEMA Reproductive Health. If you're on this call, then we hope you share our vision, which is a world where healthy, equitable, resilient sexual reproductive health product markets reach our communities, especially so women and adolescent girls can control their lives and their futures. Next slide. Sexual reproductive health product access really relies upon a number of ecosystems functioning, as you see on the left-hand side of this screen. And they need to work in an interconnected way and at multiple levels: subnational, national, regional, global. One of those ecosystems is markets, which is the economic exchange between suppliers, buyers, consumers. And we know that that ecosystem is healthy if it has the conditions that are listed on the right side of the screen. So if the market is responsive to consumer preferences, if there are equitable and sustainable prices and financing, if there's secure supply to quality product, if new innovations are being introduced effectively. But this doesn't happen naturally, especially for health markets. So what we believe, which is you need to have sort of a monitoring and response system. So you need to have a system that is monitoring market data about consumer preferences, public and private trends, looking for issues. And then you need a response system when it sees a risk or an opportunity that can design interventions and take advantage of those risks or opportunities. And to us, that is market stewardship, what we call market stewardship, having that monitoring and response system. Next slide. Historically, the market stewardship role in the sexual reproductive health space has really been led by a few number of global donors and buyers. Think UNFPA, USAID, Gates Foundation. But what we're seeing, which is with the increasing role of countries, the increasing role of private sector, decreasing external funding for these countries and partners, that really this responsibility of things around financial planning, procurement sourcing strategies, negotiating with suppliers, around price structuring, all of this is being led more and more by countries. And so our focus is on how can we strengthen countries' market stewardship so that we're prepared for this future. Today, you are going to hear about 3 countries who are on this journey supported by SEMA. They have been doing market assessments, looking at the market conditions like price, quality, financing, as well as assessing their market stewardship capacity around access to market data, market analytics. You're going to hear, what do countries see as market issues? What issues are they prioritizing? and where do they want support to strengthen their local market stewardship. Next slide. First, you're going to hear from our colleagues in Burkina Faso. They may be off video given some bandwidth issues, but that's Dr. Charlemagne Topsaba and Dr. Tangahire from the ministry. Then we will go to Senegal. We will hear from Jumane from Chai, as well as Mr. Sirili from the ministry. And lastly, we will go to Nigeria. You will hear from Adekemi Ngolade from Chai and Dr. Ibaranke Dada from Farm Access. And lastly, Dr. Victoria Amwera. At the end, we'll have about a 20-minute Q&A session. You can put your questions in the Q&A at the bottom, and then we will wrap up. And with that, I will pass to Dr. Tapsoba.
Merci beaucoup, Blair. En ce qui concerne les résultats de l'évaluation, nous avons utilisé le cadre des marchés sains de SEMA qui est essentiellement composé de deux parties, et le caractéristique du marché et les fondements du marché. En ce qui concerne les caractéristiques du marché, la première dimension est la résilience. Et nous avons donné le score 2 sur 5 à la résilience parce que nous avons noté que le financement était fragmenté et que ce financement dépendait des sources externes. Par exemple, en 2021, 70% donc des fonds destinés à l'achat des contraceptifs provenaient des fonds des donateurs. De plus, nous avons trouvé que les produits enregistrés provenaient d'un petit groupe de fabricants internationaux. Il n'y avait donc pas de fabricants local. En ce qui concerne l'abordabilité, nous avons donné le score de 3 parce que nous notons que la politique de tarification mise en place par l'État limite un peu la compétitivité du marché et n'attire guère le secteur privé. Pour preuve, le secteur privé ne dessert que 6% des utilisateurs. Et pour l'approvisionnement, nous avons donné le score 4. Voilà, parce que nous avons noté que la disponibilité de l'offre est forte au niveau du secteur public et de celui des ONG, même s'il existe quelques difficultés donc, pour l'approvisionnement au niveau du marché mondial. En ce qui concerne la dimension demande, nous avons donné le score 3 sur 5 parce que nous notons que les acteurs ne prenaient pas suffisamment en compte les préférences des utilisateurs dans la demande. Par exemple, les prévisions utilisaient uniquement les données de consommation. Pour la qualité, nous avons donné le score de 3 parce que nous trouvons que les produits sur le marché respectent les normes de qualité de l'Agence nationale de régulation pharmaceutique, mais force est de constater que seuls 3 des 5 produits qui ont une préqualification OMS sont enregistrés donc, sur le marché. Pour la résilience, nous avons donné le score de 2 sur 5 parce que nous trouvons qu'il y a la possibilité d'expansion de la gamme de méthodes actuellement disponibles sur le marché. Une étude sur les préférences a révélé, entre autres, que 70% des femmes sont intéressées par les nouvelles implants à tige unique. Toutefois, il n'y a pas de mécanisme permettant de répondre à ces préférences. De plus, la capacité locale pour développer de nouveaux produits est limitée. Si nous abordons maintenant les fondements du marché, pour la dimension disponibilité des données, nous avons donné le score de 2 sur 5 parce que nous trouvons que les données du secteur privé et du secteur public et de celui des ONG étaient fragmentées avec une accessibilité et une qualité limitée, mais nous n'avons pas eu de visibilité en ce qui concerne les données du privé. Pour les bases institutionnelles, nous avons donné un score de 3 sur 5 parce que nous trouvons que les institutions chargées des achats, de la réglementation et de l'approvisionnement sont en place, mais il y a des opportunités donc pour renforcer ces institutions. Pour les outils d'analyse, nous avons donné le score de 2 sur 5 parce que les outils existants connaissent beaucoup de limites. Et nous avons également noté donc, un financement et une capacité donc, limitée dans l'analyse et le développement donc, de nouveaux outils. Pour le partenariat, nous avons donné 1 sur 5 parce qu'il n'y avait pas de partenariat pour résoudre globalement les problèmes du marché. Diapositive, s'il vous plaît. Diapo, please. En ce qui concerne les lacunes, nous avons essentiellement identifié 5 lacunes. La dépendance à l'égard donc des financements externes, le nombre limité de fabricants qui exposent à des problèmes de sécurité d'approvisionnement et de qualité, le faible engouement du secteur privé, les acteurs du marché qui ne répondent pas aux préférences donc, des consommateurs, des limites au niveau donc, des principaux fondements du marché qui entravent donc, la coordination et le partenariat. Diapo, s'il vous plaît. Diapositive, s'il vous plaît. Diapo. En termes de recommandations, donc nous recommandons une stratégie donc, de campagne auprès donc, des parties prenantes afin donc, de mobiliser les ressources domestiques et de promouvoir donc, la participation des fabricants à travers des fabricants nationaux et internationaux à travers donc, un forum. Et de mettre en place des mesures incitatives pour attirer donc, le secteur privé au niveau du marché, d'intégrer les données relatives aux préférences des utilisateurs au niveau du tableau d'acquisition des contraceptifs et de mettre en place donc, une assistance technique pour développer des données spécifiques et des outils analytiques afin d'améliorer la coordination et le partenariat. Diapo, s'il vous plaît. Alors, maintenant, nous allons donner la parole à Dr Tangayire pour nous parler un peu des réflexions du ministère de la Santé. À vous, Dr Tangayire.
Merci bien, Dr Tapsoba. Merci de m'avoir donné la parole. Alors, au titre de la valeur ajoutée de cette évaluation, nous pouvons dire que l'évaluation a eu un écho favorable auprès des différentes parties prenantes. En témoigne la qualité de nos échanges et la mobilisation des participants au cours de l'atelier de restitution qui a eu lieu en janvier 2023. Cette évaluation nous a permis en tout cas d'identifier le rôle mineur du secteur privé dans le financement et l'approvisionnement des produits SSR, comme vient de le signaler Dr Tapsoba. Et même si ce volet abordé dans l'évaluation requiert beaucoup plus de données nécessaires pour mieux comprendre le rôle actuel et futur du secteur privé dans le financement des produits de santé de la reproduction au Burkina Faso. En termes de réaction par rapport aux résultats de l'évaluation du marché, alors nous pouvons dire que nous sommes d'accord avec les résultats, en ce sens que la conduite de l'évaluation a été vraiment participative et un atelier de restitution des résultats a eu lieu le 12 janvier 2023 et cet atelier a connu la participation effective des différents acteurs du ministère de la Santé et de l'Hygiène publique, les ONG et associations, les sociétés savantes, les structures privées et bien sûr les partenaires techniques et financiers au cours duquel des échanges nous ont permis d'avoir un rapport consensuel. Quant aux recommandations qui retiennent notre attention, c'est surtout celles en lien avec le lancement d'une campagne de plaidoyer auprès des différentes parties prenantes pour mobiliser davantage des ressources internes en faveur de la santé sexuelle et reproductive, et aussi celle en lien avec la coordination d'un forum des fabricants pour promouvoir la participation des fabricants nationaux et internationaux au marché des produits de SSR au Burkina Faso afin d'assurer une sécurité de l'approvisionnement et la qualité des produits sur le marché national. La troisième, c'est celle en lien avec l'identification et la mise en œuvre des mesures incitatives pour améliorer la participation du secteur privé au marché de la santé sexuelle et reproductive au Burkina Faso. Et pour terminer, c'est surtout l'assistance technique pour développer des données et des outils analytiques spécifiques et prioritaires afin d'améliorer la coordination et le partenariat. Alors, pour ce qui est des actions ou des actions déjà entreprises par le gouvernement du Burkina Faso, ce qu'il faut noter, c'est que la santé de la reproduction est une des priorités du ministère de la Santé et de l'Hygiène publique, en ce sens que elle constitue l'un des programmes de santé prioritaires du Burkina Faso. Donc, il y a déjà eu plusieurs actions qui ont été engagées, notamment la création d'une ligne budgétaire destinée à l'achat des produits contraceptifs. Et cette ligne a été créée depuis 2008 et à partir de 2009, elle a été régulièrement approvisionnée en ressources jusqu'à nos jours pour permettre en tout cas d'acheter des produits contraceptifs et mettre à la disposition de la population. Il y a aussi le fait que le secteur privé est pris en compte dans toutes les rencontres statutaires de la santé de la reproduction. Je vais citer par là le comité de pilotage du plan national de planification familiale, le comité de pilotage de la sécurisation des produits de santé de la reproduction, le comité de pilotage du plan de passage à grande échelle des bonnes pratiques en santé de la reproduction et bien d'autres cadres statutaires au cours desquels le secteur privé y participe et bien sûr contribue avec des réflexions, des idées pour pouvoir améliorer les choses. Donc, afin de promouvoir une autonomie financière de la PF au Burkina Faso, le ministère en charge de la santé a élaboré en 2021 une feuille de route avec comme stratégie d'intervention l'élargissement de l'éventail des sources de financement disponibles. Comme tantôt signalé, la plupart des sources de financement sont extérieures. Donc, il fallait vraiment réfléchir sur comment mobiliser des ressources endogènes au profit de la santé sexuelle et reproductive. Pour cela, nous travaillons vraiment en collaboration avec le ministère en charge des Finances et de la prospective, le ministère de l'administration territoriale et de la décentralisation, à travers bien sûr les collectivités territoriales, et aussi prospecter auprès des sociétés minières qui sont implantées au plan national et aussi les réseaux de téléphonie mobile pour davantage mobiliser des ressources endogènes au profit de la planification familiale particulier et bien sûr de la santé de la reproduction de façon globale. À ces actions, il faut noter aussi à partir de 2020 le décret portant la gratuité totale de la planification familiale au Burkina Faso. Et donc, il faut dire que la PF est portée à un plus haut niveau de la hiérarchie au niveau du Burkina Faso. Et donc, cette gratuité de la planification familiale a été effective depuis le 1er juillet 2020 sur toute l'étendue du territoire du pays. Alors, il y a aussi le processus en cours d'introduction de certains produits PF, comme le DMPA sous-cutané dans les officines pharmaceutiques. Il y a eu l'élaboration d'un plan d'introduction qui a été validé et bien sûr, le processus est toujours en cours afin de rendre disponibles davantage les produits de PF au profit de la population. Et après les résultats de cette évaluation, bien sûr, des priorités ont été identifiées au regard des résultats de l'évaluation au cours d'un atelier et nous travaillerons vraiment à étudier, en tout cas à mettre en œuvre les actions qui ont été proposées, voilà, pour mettre en œuvre ces différentes priorités qui ont été identifiées. À cela, il faut dire que les unités de production sont d'abord au stade embryonnaire au Burkina Faso, mais nous avons en tout cas une société, la société Profarm, qui est implantée et qui prévoit désormais produire des contraceptifs oraux et plus tard des méthodes de longue durée, notamment le Jadel ou le dispositif intra-utérin. Et donc, les demandes d'autorisation de mise sur le marché ou des demandes d'accréditation sont en tout cas en cours afin de pouvoir finaliser ce projet qui pourra en tout cas aider aussi le pays à être autonome et à pouvoir en tout cas rendre disponibles les produits de santé de la reproduction à tout moment et à tout lieu au profit de la population. Alors, les domaines pour lesquels nous espérons, en tout cas, nous attendons des appuis auprès des donateurs et des acteurs techniques, c'est surtout dans le domaine de l'implication des fabricants nationaux et internationaux au marché des produits de la santé de la reproduction, soit au cours d'un forum ou au cours d'une table ronde, comme l'a recommandé bien sûr l'étude. Il y a aussi l'élaboration d'une feuille de route en vue d'identifier les mesures incitatives pour la participation du secteur privé au marché de la santé sexuelle et reproductive au Burkina Faso. Également, un appui technique dans le développement des outils analytiques du marché, la coordination et bien sûr le partenariat. Et enfin, en tout cas, prospecter la réalisation d'une étude sur la segmentation du marché pour identifier les niches potentielles et les obstacles relatifs à l'entrée du secteur privé dans le marché des contraceptifs. Et bien sûr, le type de soutien d'ordre technique et bien sûr financier aussi. Alors donc, je suis au terme de mon speech et je voudrais, au nom de ma hiérarchie et au nom de tout le ministère, remercier SEMA et remercier également tout le consortium pour avoir réalisé cette étude au Burkina Faso, chose que les résultats pourront véritablement nous permettre d'orienter, d'adresser des actions concrètes sur le terrain afin de pouvoir améliorer les choses. Donc, je suis au terme. Je vous remercie.
Great. Thank you so much, Dr. Tangahiri. We will now pass to Senegal, and I will hand it over to Juma. Thank you.
Thank you very much, Blair. So I would like to start this presentation by applauding the Senegalese government through its Ministry of Health, and more specifically, the Direction de la Santé de la Mère et de l'Enfant, the SEMA, for placing maternal health among top priorities. As a country, the results we have achieved in terms of reduced maternal mortality and increased satisfied demand for family planning demonstrates the SEMA's considerable efforts to develop and implement effective strategies under the strong leadership of its director. So here you have a representation of Senegal's framework with the score for each component. As you can see, Senegal's reproductive health market performs strongly on dimensions of price and quality. Price scores strongly because the public sector products are heavily subsidized, while sale markups are fixed, benefiting the consumer. The quality dimension is strong because Senegal has strong regulatory policies and systems ensuring quality in the public sector. The least performing dimensions we have are financing and supply, given the heavy reliance on donor funding, which undermines supply security and sustainability. The market foundations of data, analytics, and management also need to be strengthened. So, next slide, please. Okay, so here for Senegal, we have 6 main challenges. The first one is the low availability of quality data. So market data is fragmented between different market tools, such as the visibility and analytics networks, the pipeline software, the DHIS2, and inventory software called the RPX3. So this data fragmentation hinders the SEMA's ability to monitor trends in method utilization and adoption and make decisions to improve contraceptive availability. Moreover, for the quantification of contraceptive needs, the country uses distribution data because we don't have access to consumption data. And having access to that data would enable more accurate quantification, but there are also critical contextual factors that have made collection of consumption data challenging in Senegal. And you can find further details in our report. We also have insufficient understanding of users and service providers' needs. We must acknowledge that Senegal has recorded remarkable trends in the increase of satisfied demand for women of reproductive age. and the use of modern contraceptive. So we have the modern contraceptive prevalence rate, which rose from 10.3% to 25.5% from 2005 to 2019. And the increase was largely driven by injectables and implants. And however, we noticed a timid increase of 0.1 percentage points, which increased from 25.4% in 2018 to 25.5% in 2019. And we have limited visibility into the reasons for this. Moreover, the country does not have recent studies on user preferences and insights on family planning. We also have limited recovery and revenue for family planning products. While prices to end users in Senegal are generally favorable, the public sector subsidies and fixed margins may undermine resupply of family planning products. So in the public sector, service delivery points rely upon a cost recovery scheme. So they have incentives to stock high margin products rather than family planning products. We also have donor dependency. The government is making considerable efforts to increase its spending on family planning. According to the recent health accounts in 2020, 1.2 billion were allocated to family planning, representing 20.8% of the shares of current family planning expenditures. And the purchase of contraceptive products represented 28.5% of those expenditures. And despite those efforts, the funding remains heavily dependent on UNFPA and USAID. But the recent introduction of the West African Health Organization as a new source of funding is increasing diversity. For 2023-2025, the donors' contribution to family planning commodities procurement are estimated between 83% and 88%. And the heavy reliance on donor funding makes the country vulnerable to sudden funding shifts and reductions. We also have the dependence on imports, with Senegal, who remains vulnerable to shocks in the global supply chain. And all the contraceptive commodities we have are imported. And this confirms the country's dependence on imports, despite the existence of 6 pharmaceutical production units. You have political, health, and security crises, which can cause international transport instability. For instance, during COVID-19, one of the main challenges for procurers was the cost of freight, transport, as well as the extended delays for product delivery. And there are also challenges which are related to obtaining import authorizations. For the last challenge, it is the insufficient involvement of the private sector. So in terms of regulations, the Pharmacist Code of Ethics prohibits the practice of consultations or medical acts in pharmacies. And this represents a major constraint in engaging pharmacies in the offer of family planning services. And in terms of coordination, according to the 2017 Shops Plus mapping of the private sector, approximately 28.1% of private healthcare structures were involved in coordination meetings, and less than 25% share their activity reports with the public authorities. So next slide, please. Based on the identified shortcomings, we prioritize the following interventions. So this list is not exhaustive, and you can find the rest of the recommendations in the report. And I know we will have the chance to talk about some of these during the ministry's intervention. So for example, for recommendations, we have the introduction of the quantification analytic tools to improve analysis and quantification to guide market decisions. We have the implementation of an integrated logistics information management system for reproductive health and contraceptive products to facilitate decision-making. We have to collaborate with partners to identify cost-effective strategies to gather data on users' preferences as input for market strategies. We also have to explore alternative strategies to increase national funding to meet financial needs. We have to examine opportunities to improve trade and tax policies to attract local manufacturers. We also have to pursue regional and global dialogues under the leadership of WAHO to identify opportunities to attract a local or regional supplier. So thank you very much. Maintenant, je vais passer la parole au chef de la cellule logistique de la direction de la santé de la mère et de l'enfant, Monsieur Cirelli, qui va donner les impressions du ministère sur cette évaluation. Merci.
Voilà, merci beaucoup, Juma. Donc, nous allons partager avec vous les impressions du ministère de la Santé sur cette évaluation de marché total. Tout d'abord, dire que cette évaluation nous a permis de mettre en exergue les efforts que le gouvernement concentre dans la santé de la mère, des enfants, mais également des adolescents. Les programmes successifs sur les changements dans les lois et règlements relatifs à la santé reproductive reflètent les efforts continus du gouvernement pour créer un environnement favorable pour la planification familiale. Donc, pour atteindre également le taux de prévalence contraceptive qui est attendu de 46% en 2028, donc il faudrait que nous ayons des évaluations de ce genre. Donc, appuyé également par des études pour résorber les gaps observés au niveau du marché des produits et services de santé et reproduction. Donc, nous avons vu l'utilité d'avoir cette autre évaluation de la chaîne d'approvisionnement et du marché dans sa globalité, donc pour engendrer les parties prenantes sur les défis communs au niveau du pays. Nous souhaitons refaire également cette notation dans le futur pour mettre en exergue les problèmes. L'évaluation nous a permis également de mettre en exergue les réalisations déjà réalisées par la direction de la santé de la mère et de l'enfant. Donc, je peux citer entre autres l'interopérabilité entre le DHS2 qui est un logiciel de rapportage au niveau opérationnel et le RPX3 qui est un outil de gestion donc au niveau du central d'achat, donc qui couvre le niveau central et également le niveau régional. Donc, on voit également en vue l'introduction du CAT, donc c'est quantification analytique tool, donc il va venir bientôt, donc sûrement au mois de janvier, il va planifier ses activités. Donc, de plus, nous voyons la nécessité de regarder plus en profondeur des détails relatifs à l'offre de services et à la génération de la demande, donc pour mieux orienter les interventions pour atteindre le taux de prévalence contraceptive qui est de 46% en 2028. Donc, pour les impressions, donc les résultats de cette évaluation reflètent la réalité du marché donc, dans le pays et nous donnent une photographie sur les gaps existants donc, dans le domaine amélioré. Donc, nous avons déjà commencé le partage de ce rapport donc, avec le comité national de sécurisation des produits de santé reproductive donc, pour que les recommandations soient appropriées par toutes les parties prenantes, donc tenant compte de la diversité donc, des acteurs qui sont sur le marché. Mais également, il serait intéressant de coupler cette évaluation qu'on vient de faire à des études donc, beaucoup plus approfondies donc, qui nous permettront ainsi de compléter le travail. On note également une dépendance des partenaires techniques et financiers, surtout sur l'achat des produits contraceptifs. Nous savons aussi que les prix des produits contraceptifs dépendent des quantités de produits achetés. Donc, plus qu'on achète des quantités élevées, plus le prix est bas. Et avec les acheteurs comme les AID, comme l'IFP, donc qui achètent en gros, donc pour plusieurs pays en même temps. Ce n'est pas le cas pour notre centrale d'achat qui achète en petite quantité donc pour le Sénégal une fois. Comme vous le savez, le Sénégal a eu des engagements donc, pour accroître le budget de l'État qui est actuellement à 500 millions et nous voulons aller à 1 milliard donc, pour contribuer à l'achat de ces produits. et garantir l'accessibilité et la disponibilité des produits de la planification familiale. Pour les recommandations, donc les recommandations nous permettront de nous pencher davantage sur certaines questions de cette évaluation qui a suscité beaucoup d'allers-retours en profondeur dans l'analyse. Et cela va nous permettre d'abord, pour les recommandations, d'élaborer et de tester les stratégies efficaces pour comprendre et collecter les données sur les tendances d'utilisation dans le secteur privé en tirant des logiciels de gestion de stock pour fournir des informations régulières. Mais également de faire le maximum pour avoir l'introduction du CAT, donc développé par l'USAID, pour améliorer l'analyse et la quantification des produits contraceptifs pour des prises de décision relatives au marché. Donc, juste rappeler que présentement, on est en train de faire la quantification nationale des produits PF, mais également de mettre en place un système de gestion de l'information logistique sur les produits santé reproductifs et les produits de contraceptifs intégrés, donc qui va faciliter la prise de décision. Donc, tous ces systèmes doivent permettre à la disposition des décideurs pour avoir un tableau de bord sur la disponibilité et l'utilisation des produits santé mère-enfant. Et également collaborer avec les partenaires afin d'identifier les stratégies rentables innovantes pour accueillir des données sur les préférentiels des utilisateurs en vue d'élaborer des stratégies dans le marché. Nous pouvons aborder dans cet angle, surtout ce qui concerne des stratégies alternatives pour augmenter le financement national. Donc, sur ce point, donc, nous avons développé quatre points. C'est d'abord l'augmentation du budget de l'État pour l'achat des produits contraceptifs. Le deuxième point, c'est une meilleure implication des collectivités territoriales donc, pour la participation également avec la planification familiale, mais également une mobilisation des ressources dans le secteur privé et l'intégration des produits dans la liste nationale pour rembourser partiellement avec les couvertures maladie universelle. Donc, l'objectif final, c'est vraiment d'aller à la souveraineté budgétaire pour le pays. Donc, quelle est notre impression par rapport à ça? Donc, nous avons conscience des gaps qu'on a identifiés et le pays a entamé des efforts dans ce sens. Donc, on a fait beaucoup d'efforts. Entre autres, on peut citer l'interopérabilité que je viens de dire tout de suite entre les deux logiciels, des ERP-Exploit et DSS2 qui est finalisé, qui est elle. Donc, l'ERP-Exploit également qui est en extension dans 47 districts, donc le Sénégal qui compte présentement 79 districts, mais également la formation au mois de janvier sur le CAT, donc avec l'USAID, pour vraiment prendre cet outil comme outil de planification dans la prochaine planification. Et avoir une feuille de route qui est en cours d'élaboration pour l'industrie pharmaceutique nationale. Et également, il faut rappeler que l'État a mis en place l'Agence sénégalaise de réglementation. L'Agence Donc, l'État a mis en place l'Agence sénégalaise de réglementation pharmaceutique, donc, qui est une agence avec des pouvoirs étendus pour gérer, favoriser la sécurisation des produits pharmaceutiques. Et également la centrale d'achat, maintenant, qui est devenue CNPNA, donc avec des d'approvisionnement beaucoup plus grandes et également la production locale des médicaments pour les produits pharmaceutiques. Pour terminer, donc, nous allons dire pour mettre en œuvre ces recommandations, donc nous avons besoin tout d'abord d'organiser des réunions de concertation avec tous les acteurs clés pour faire un avitage et nous concentrer sur celle-ci et sur les priorités. Donc, nous avons également besoin nous avons besoin de l'appui des partenaires techniques et financiers pour vraiment faire la cartographie des besoins et mettre en œuvre les informations. Donc, c'est ce que on voulait partager pour l'impression du ministère de la Santé du Sénégal par rapport à cette évaluation. Donc, remercier SEMA pour cette évaluation qui nous a permis de prendre des décisions donc, pour le bien-être de nos populations. Merci à vous.
Understood. Thank you. Dr. Lee, just so you know, we had some troubles hearing you. So we will make sure for everyone, we try to get a transcript and share it so that everybody heard all of your very thoughtful comments. So we know you had a lot of great suggestions and reflections from the effort and sharing some of the work you all are doing. And it's important for people to hear that. So we will make sure that we also share that with everybody in our follow-up notes. Thank you very much, everyone. And with that, let me pass over to Nigeria and we'll go to Adekene.
Okay. Thank you very much, Blair. Good afternoon, everyone. Just to give some context, the healthcare system in Nigeria is structured into two main levels. There's the national and the sub-national level. And each of those levels are responsible for various decisions that impact on the healthcare health market and especially the SRH market. Therefore, the SRH market assessment in Nigeria was done in two parts. Clinton Health Access Initiative carried out the federal level market assessment, and a consortium led by Farm Access carried out a state level market assessment across 5 states. I will speak to the market insights and recommendation at the federal level. So the assessment aimed at the federal level to identify and define the current market landscape for SRH products and the challenges within the market. So, and then using the Nigeria's overall SRH priorities, TRI worked with key stakeholders in the public and private sectors to define a desired future state along the dimensions of the healthy market framework. We currently are finalizing the country level strategies to achieve the goals of the desired future state. So here are some of the insights on the challenges with the SRH market at the federal level. First of all, there was more information available on family planning at the national level compared to maternal and newborn health. And this is primarily due to the fact that procurement decisions around maternal and newborn health happens at the state level, while for family planning, that happens at the federal level. So in collecting data, accessing information along the healthy market framework domains, we were able to get more information on family planning. Another thing which came out of the assessment was that there is a lack of coordination and collaboration with the private sector. And this was owing to the fact that, I mean, this is kind of critical, given that the private sector is responsible for 70% of market access for healthcare. And within the SRH sector, especially for family planning, the public-private sector mix is 40 to 60. Thirdly, we saw that the financing was characterized by poor budgetary releases compared to the commitment for funding. And this is further compounded by a widening funding gap within the SRH market. And then even though market data is available, it is quite fragmented, and this is due to the fact that we have vertical programming. And like I mentioned earlier, the lack of collaboration means we don't have insight into data coming out of the private sector. Next slide, please. So here are some of the recommendations which we came up with to address the gaps that were identified. The first recommendation will be to utilize government financing mechanisms to increase the availability of SRH services and commodities. And this will be done by identifying ways to expand domestic funding for SRH through the public and private sectors. And also, we thought about the fact that we could establish public-private partnership approaches that would encourage private sector participation. To address issues with supply, the recommendation was to provide an enabling environment for local manufacturing of SRH commodities. The third recommendation was to improve the stakeholders' capacity for data reporting, integration, and analytics for effective service delivery and informed decision-making. And then to address the issues with market management at the national level, it was agreed that we could harness the private sector capacity to promote access to SRH commodity and services, as well as strengthen SRH policy implementation and support the states to domesticate the existing SRH policies. So thank you for listening. I will hand over to Dr. Ibiro Kedada to speak to the state level market assessment.
Thank you very much, Adekemi. So in Nigeria, we actually worked in 5 states. We had a consortium led by Farm Access, working closely with Halcyon and the Private Sector Health Alliance of Nigeria. The 5 states selected were pretty much taken because of their political commitment to strengthening their SRH markets. The 5 states are Ekiti, Kaduna, Lagos, Niger, and Osun. We applied the National Healthy Markets Framework in all 5 states and found that none of the states were the same. They were all unique in their results. But we did find some similarities in terms of market conditions and foundations. Looking at market conditions, financing, supply, and consumer demand, across all 5 states, scores ranged between 1 and 2 out of 5, whilst under market institutions, all the states had the same score of 2 out of 5. Next slide, please. So across all 5 states, we were able to reach these as some of the common market shortcomings. What we realized is that as much as they had different results in terms of scores, the challenges across all 5 states were really similar. There's a heavy dependence on donor financing in Nigeria. All states rely on the federal supplies for their SRH market commodities. And this for us really shows that the market is not resilient. Looking at all 5 states, they all experience at some point stockouts in certain commodities. We found that in Nigeria, there's really no local manufacturing capacity. And this for us is contributing to security concerns when it comes to quality and supplies. We also discovered that there's limited private sector engagement by government, and there's very little visibility into the private sector, and there's limited coordination across all states. I think with the exception of maybe Lagos, where we could find some interactions between government and the private sector, in other states, this was almost non-existent. We found that across all states, there's very limited capacity, and in some states, no capacity for market stewardship, and very little capacity in working on analytical tools to assess the market, and even in situations where, when it comes to quantifying and forecasting for commodities, there's very limited capacity across all states. Most states did not factor into their forecasting and quantification exercises, the private sector. In some states, we did not even have a technical working group on SRH, or reproductive health. Next slide, please. So in terms of recommendations, we would like to start with strengthening the market foundations. And we need to look at the availability of data from the private sector. Data from the private sector is really not available, especially when you look at community level services, community pharmacies and patent medicine vendors. Yes, the private health facilities do submit data to the district health information system, but we don't have that when it comes to the community pharmacies and patent medicine vendors. And we want to acknowledge the fact that once there's data, there's better, there should be better SRH market stewardship. We would also like to enhance market coordination. For instance, in Niger State, there was no SRH technical working group. And so that was one of the things that was formed during the period where we worked with Niger State. And we also recommended to all the states to establish SRH market groups with wide stakeholder representation. In some, it's expanding the technical working group. In some, it's looking at the procurement, supply, management committee. Then we also recommend strengthening the procurement systems. What we found, out of the 5 states, only 2 states actually committed some funding or released funds for the procurement of SRH commodities, but it was really for emergency procurement. And what we recommend is that it would be good if the procurement process is adequately planned so you can actually enjoy the economies of scale. And then we worked with all 5 states to develop SRH market strategies, hoping that within 6 years we'll have a more resilient and sustainable SRH market. And so I would like to hand over to Dr. Omera, who is the Reproductive Health Coordinator in Lagos, to speak about the reflections of government.
Good afternoon. Just like to say that I'm having some network challenges, and so somewhere in between I might need to switch off my video. Thank you very much. For us at the state, sexual and reproductive health is a priority. We think it is really very serious and it is a right. And so over the years as a state, we've always wanted to work with everybody. A small background to Lagos State is the largest state, but in size, surface-wise, is the smallest, but we have a large population. It's the mega city. And so we have a very vibrant private sector. Research has shown us that more than 60% of our participants or people who live in Lagos go to the private sector. And when you think about the fact that even though a lot of emphasis is placed on the public sector, we have some wards that don't have any presence of the public sector. So it is very important that the private sector is carried along. And so services are available not just in the private clinical sector, but in the non-clinical sector. So you're looking at community pharmacists and the patent medicine vendors. And so for us, the SRH assessment was really very key. And in terms of participants at the SRH assessment, what we did was to pull in members from our family planning technical working groups and our safe motherhood technical working groups. And within this technical working groups, we have core private sector providers, public sector providers, other line ministries in the government. We had social marketers, and very importantly, we had members from our logistics management coordinating unit who usually are in charge of procurement supplies for all commodities, inclusive of sexual and reproductive health commodities. Now in Lagos State, there's slightly different ways in which we run our sexual and reproductive health. For things like family planning, that is usually free because we see family planning not just as a social benefit, but something that is of economic development issues. So we've tried to say that the service should be rendered free. And so usually we will get our commodities from the National Basket Fund, but for the very first time, and proud to say that for the very first time last year, we committed some funding that was released and we did procure family planning commodities. In addition to that, we also provide family planning consumables so that when we have clients who go to the public sector, this service is free. but that is just the public sector. There's a large private sector, like I said, over 60%. And so the assessment showed us that there was still a large gap in terms of providing services to the population in Lagos State. If you looked at the data in terms of just having data available to us, just like Dr. Dada said, data is largely available for the public sector, but for the private sector, we struggle to ensure that data is available. And when available, is usually just service provision. In terms of commodity supplies and so on, there's usually no visibility into what happens in the public sector. And so in terms of community level data, that is available in some places because we have a program that looks at pushing out sexual and reproductive health services, especially family planning, through the patent medicine vendors and the community pharmacists. But we don't have insight into the commodity data. So we don't have any harmonization across the entire state. So the full potential of that partnership really isn't being felt or realized. And the quantification is usually just done for the public sector. Is largely public sector driven. And when you look at things like family planning, demand is still generally very low, very, very low. I mean, you have people in Lagos State with the cultural and religious differences, and that's still something we need to work on. So with the assessment, we narrowed down to a few things we think we can still improve on and ensure that we're getting it right. The level of data completeness, sharing, handling, and validation, including also pulling in data from our community-based HMIS when that is ready to roll out in full supply. Because we realize that all the quantification we have been able to do, and we do have capacity to do quantification, and we have been doing this over the years, but that's largely for the public sector. So we haven't taken into consideration the large private sector that exists. And so there's a need for integration for the public and private sector. We're looking at mapping our services, building capacity across board, integrating the analytical tools so that when we pull in data, the data is pulled in across the entire state and quantification is done across public and private sector. We need to be able to identify key private sector stakeholders that will be involved in this process. We need to be able to leverage existing data from the public and the private sector, and then review our procurement plans. We're being intentional about ensuring that the private sector is captured and carried along. And for us to do that, we need to strengthen the relationship between the public and private sector, with focus on sexual and reproductive health commodities, procurement, forecasting, procurement, easy accessibility for all concerned, looking at what public-private partnerships we can work with, the framework, and being able to collect data across board so that we have some knowledge management repository where we can have data to work in. And more importantly, across board, we need to be able to increase demand generation for family planning products and services, reviewing our demand generation strategy. And so across the entire state, if you want to access services in the public sector or you want to go to the private sector, the service is available. We don't want a situation where the out-of-pocket expenditure, which is already very high, we don't want to get in any higher. And just to say that as a Lagos State, we're committed to this effort. We want to ensure that if you're in Lagos, there's access to sexual and reproductive health because it is a right and that should be honored. Thank you.
Great, thank you, Dr. Moore. Really appreciate it. And thanks everybody. I hope you all enjoyed listening to these different presentations. I think it's always fascinating to kind of appreciate what's similar, what's different. These are three contexts grappling, as people noted, with different combinations of sort of mixed public-private sectors, different financing situations, different ways that they're pricing their products in the public and private sector, ways that they're working with private sector. I think it's actually incredibly useful to sort of see three different contexts and sort of how they are grappling with these issues and where they are in sort of their own evolutionary path. A couple questions I have. I will start, Dr. Moore, I have one for you, then Dr. Sangahire, and then Mr. Siri will try to see if we can hear you better. Dr. Moore, the question I have, which is around how you've been able to incentivize the private sector to participate in these different workshops or in planning. Sort of what do they get out of it? How have you been able to coordinate with them? Over to you.
Okay, so we walk through the regulatory agency for the private sector, which is the Health Facility Monitoring and Accreditation Agency. And what we tend to do with the private sector is try and provide capacity building sessions for them. So the capacity building sessions are a cost to government, but to them it's free. So when we have protocols, trainings, and so on, we walk to them. So that is supposed to be some sort of an incentive. And earlier on in this partnership, when we used to get the kind of commodities we required, we used to push some to the private sector. So we came up with an agreement. If we push commodities through the private sector, they could charge what we call an administrative fee, just to cover an administrative cost, so we could get participants or clients into the private sector. But by and large, we give them free capacity building as some sort of incentive to get them to work with us.
Really helpful. Thank you. Dr. Tangahire, a question to you around you made an observation about how you are working with long-acting product production, perhaps kind of purchasing locally. You can clarify if they heard that correctly. The question, which was, when you're a small country with low volumes, how are you able to sort of negotiate getting a local supplier? Again, I think the question is really about volumes and supply management, and if that's adequate sort of financial viability for a manufacturer, and sort of how you're managing that question. Hope that made sense.
Oui, j'ai saisi un peu la question. Alors, merci beaucoup pour cette question. Pour ce qui est des fournisseurs locaux, j'ai fait cas du Profarm SA. Mais il faut dire qu'on est toujours au stade. Les marches sont d'abord en cours avec, bien sûr, le ministère pour accompagner cette unité de production. Et ils ne vont pas d'emblée produire les méthodes de longue durée. Ça, c'est à long terme. Le processus, c'est d'abord avec les contraceptifs oraux, notamment les pilules, les microginons, les INIA ou le microlus. Et plus tard, avec bien sûr la prospection, étendre bien sûr la production à d'autres méthodes contraceptives. Donc, le processus n'a pas encore commencé. On est toujours dans les démarches, bien sûr, avec l'Agence nationale de régulation pharmaceutique, avec bien sûr la centrale d'achat des médicaments essentiels. Et il y a des conventions qui sont en train d'être élaborées pour être signées avec bien sûr les différentes parties prenantes. Donc, c'est pour dire qu'on est toujours au stade de mise en place de tout ce qui est documentation avant que l'unité ne puisse commencer la production. Merci beaucoup.
Thank you, Dr. Tangahire. Very helpful. Let me go, there's Mr. Siri, we'll try to see if we can hear you, and if not, we'll move along. But there's a question about the financing. It sounds as if Senegal has really increased its financing for sexual reproductive health. And the question was, it still doesn't seem to be enough. And how are you sort of targeting that financial support to the most vulnerable populations? Or did we lose him entirely? Sure, Mr. Siri. The question is, hello. The question is, for you in Senegal, it's great to hear the increased financial commitments to sexual reproductive health. It still isn't enough. And so how are you looking at targeting or supporting the funding for the most vulnerable populations?
Ok, d'accord. Merci beaucoup pour cette question. Donc, on parlait surtout sur l'achat des produits contraceptifs et on disait qu'il y a eu vraiment un appui fort des partenaires techniques et financiers. Mais néanmoins, le Sénégal contribue présentement à hauteur de 500 millions sur l'achat de ces produits contraceptifs. Et il y a un engagement de l'État pour aller à 1 milliard d'ici 2027. Maintenant, il y a d'autres stratégies qui sont là pour augmenter le financement national afin de répondre aux besoins financiers. Donc, parmi ces stratégies, on peut citer l'augmentation que je viens de dire de la part de l'État, mais également une meilleure implication des collectivités territoriales. C'est-à-dire au niveau des régions, il y a les collectivités territoriales, les maires vont également s'investir et s'activer sur la contribution financière pour la planification familiale de manière générale. Le troisième point, c'est une mobilisation des ressources avec le secteur privé, donc avec les industries qui sont là. On peut faire le plaidoyer pour également avoir des financements pour la planification familiale. Et l'autre stratégie, c'est d'intégrer les produits de la planification familiale dans les listes des produits remboursables avec la couverture maladie universelle. Donc, c'est les 4 stratégies que nous comptons développer vraiment pour aller vers la souveraineté budgétaire. Merci à vous.
Great, thank you, Mr. Sire. I'm going to go to a question in the chat. This is for Nigeria. So question is pooling commodity procurement among the 5 states feasible in Nigeria, considering the fiscal challenges in Nigeria? Dr. Moira, I don't know if you want to try that, or Dr. Dada or Adekene.
Okay, so let me try and answer this. So sometime last year, we all worked together, key stakeholders across the state level, guidelines for the state level. We looked at pooling funds together from the state into the National Basket Fund. So in terms of economies of scale, we were able to get a lot more products than going individually, and having the United Nations Population Fund, UNFPA, sort of coordinate the procurement process. So that's currently ongoing efforts. We're launching the documents in the various states and getting governments to commit to pulling funding into that National Basket Fund. So that's work in progress.
Really helpful. Just your thoughts in terms of, given just financial challenges, your thoughts around any reflections or kind of considerations about how challenging it would be to be able to pool commodity purchasing amongst those different states?
Commitment from the commissioners at what we call maybe like a National Council on Health, where we get all the commissioners to commit to contributing funding into that National Basket Fund. It usually is the best way to go. We might not get everybody to go on board, but it's also nice if it gets into like a scorecard for the commissioners. There are ways in which you can play around such things if they're being benchmarked on their contribution to family planning, and seeing it beyond just planning your families, but more of a social, economic, or developmental issue. That might be the best way to go, but it's always hard to get 36 states plus 1 on board in everything you do. But we must try. We must try.
Great. I like the positivity. Let me ask you, and then I will go to Dr. Tangahire, or actually this is for Mr. Sire. There's a question around in Senegal and Nigeria, how the SRH community is working with the broader private health federations and if the efforts are aligned with the national private health strategies. Dr. Moira, can I turn to you for that, and then Mr. Searing?
Okay, so there's a private sector, the strategy on private sector engagement. That hasn't kicked off as well as with 132. There was a document that was developed. So sometime in November, we're sort of attempting to start all over again with a workshop in November. And for us, that is very key because we have a large
I think we may have just lost you. Yeah, Dr. Moira, sorry, I think we just
probably
lost
just
you.
look at them in terms of from you. What are the rates? You give us better rates or not? But hello, can you hear me?
You're back now.
Okay, so like I said, even though we do work with them, we look more in terms of the clinical aspects. Do they have trained providers, and can they render the service?
Dr. Moira, I think we lost you again.
But it really should be hoping to relaunch next month. Apologies.
No problem. You just keep coming in and out. But we heard it should pick back up next month.
Yes. So we're hoping to restart that process next month.
Fantastic. Thank you. Sorry about that.
Thank you.
Mr. Sire, any response to the question around how the SRH community is working with the broader private health federations and if the work is aligned with the national private health strategy?
Voilà, merci beaucoup pour la question. Donc, effectivement, il y a une bonne collaboration entre le secteur public et le secteur privé. Donc, dans l'entame de mes propos, je disais qu'il y a le nouveau plan planification familiale 2024-2028, donc qui est élaboré et partagé avec les acteurs du niveau central. Donc, ça, c'est juste la validation institutionnelle. Et dans ce plan, on a vraiment mis en exergue beaucoup de stratégies innovantes avec le secteur privé. Donc, c'est juste pour dire qu'il y a une bonne collaboration avec le secteur privé. Bien vrai que sur le plan donné, comme l'a montré cette étude, donc sur le plan d'information, donc il y a également des choses à améliorer et c'est pris en compte dans le nouveau plan PF 2024-2028. Merci.
Thank you, Mr. Sire. And Dr. Tangire, even though the question wasn't directed to you, do you want to answer a similar question around how the SRH community is working with the private sector federations and the alignment with the private sector strategy? Did I lose Dr. Tangire?
Ok, merci bien. Alors, la collaboration avec le secteur privé, quelquefois au niveau du Burkina Faso, en tout cas, les stratégies qu'on a mis en œuvre, c'est que toutes les rencontres qu'on a, ils sont d'office impliqués parce que ils ont aussi des idées qui pourront aider le secteur public, tout comme le secteur public aussi peut faire des observations, en tout cas apporter des éclaircissements au secteur privé, afin que la collaboration puisse vraiment être solide. Alors, donc, pour ce qui est de la visibilité des données, c'est là où on a quelques petits soucis, mais nous travaillons en tout cas d'arrache-pied pour en tout cas inclure davantage le secteur privé. Nous sommes actuellement en train d'expérimenter un outil qu'on appelle NetSigle 2.0, qui est actuellement en phase pilote, mais avec bien sûr une extension avec bien sûr le privé, afin que cette plateforme qui est aussi une plateforme de gestion des intrants, le privé aussi puisse s'impliquer davantage, puisse être, les acteurs puissent être renforcés afin que les données puissent remonter de façon régulière. Et lorsqu'il y a des sessions de renforcement de capacité, nous les impliquons aussi également afin que la collaboration puisse bien marcher. Alors donc, c'est un peu ça. Et je disais tantôt aussi qu'il y a actuellement une perspective d'introduction du DMPA sous-cutané dans les officines pharmaceutiques. Nous avons élaboré un plan d'introduction qui a été participatif avec bien sûr l'accompagnement de l'Ordre national des pharmaciens, du syndicat des pharmaciens, bien sûr avec les différents grossistes de la place, afin que ce plan puisse être opérationnel pour que petit à petit, nous puissions véritablement capter tout ce qui est information, tout ce qui est potentiel qu'on peut tirer au niveau du secteur privé. Donc, voici un peu la situation au Burkina. En tout cas, toutes nos rencontres statutaires, le secteur privé y est invité. Et il y a même une direction technique qui a été créée, qui est en lien avec, bien sûr, les formations sanitaires privées, où on passe par elles désormais pour nos communications officielles ou les invitations officielles à toutes les rencontres, à toutes les activités. Merci beaucoup. Donc, voici un peu ce qui est fait au niveau du Burkina Faso.
Great, thank you, Dr. Tangihire. It's impressive how you all are actually able to engage them as much, and they're different sizes across your different contexts in terms of the private sector. So it's useful to hear these examples. I have one more question, and Dr. Moya, we'll try you, and if it's not working, maybe Dr. Dada can jump in. I think there's a question just trying to understand where SRH commodity procurement is sort of evolved to in terms of responsibility between external versus federal versus state governments. And I know it varies by context, but if somebody can just help explain that the context of where you are right now, and then talk about, there's a question here specifically asking, if you decentralized commodity procurement at the subnational level, do you think that that would actually help for broader market development? See if we can hear Dr. Moira, and if not,
let me start off. So in terms of SRH commodities, I think when you look at it, first and foremost, we're a federating state, so you can legislate across subnationals and the national level. And when you think over the past few years, a lot of commodities, especially family planning, has come in through donor partners. We understand that that is dwindling. So in terms of sustainability, it means that we all need to do a bit more to ensure that the commodities are actually available. So the plan actually is to get the subnationals, where a lot of the implementation takes place, is to sort of take ownership of these services, because really the clients are all in one state or the other. So it's to get the subnationals to do a bit more, because the funding is just not there at the national level. So even though family planning was being shouldered by basket funding, over the years it has reduced, and there's considerable out of stock of commodities. So there must be some addition to that basket fund. Now, the whole idea for family planning is to get the subnational, the state levels, to put in funding into that basket fund. We don't necessarily want the states to procure on their own. So in terms of economy of scale, in terms of guaranteeing that the commodities, quality assured, everybody putting funding into that basket fund and getting UNFPA to sort of help push the procurement process will be good for all of us. But for the other commodities in terms of SRH, that is largely done at the state level. So state governments will allocate funding through their budgets to ensure the other like maternal health products and so on are available within the facilities, either through a fee-paying system or a drug revolving fund system or something like that. So across board, we do all, it's quite a bit of work, but across board, we try and ensure that it must be available through one window or the other. But more importantly, for sustainability, everybody probably needs to do their work.
Great, really helpful. Thank you for jumping in there. One last question, and then I will do a wrap up. There's a question for Burkina Faso. So for Dr. Tangahire, a question about the introduction of DMPA SC and how necessary it is to revise the policies around provision at the pharmacy level. For those who may not have heard, there have been sort of limitations in terms of what pharmacies are able to distribute, which impedes access. And so the question is there any policy reform going on? Over to you, Dr. Tangahire.
Oui, bien sûr, il y a des réformes qui sont en cours en la matière. On veut même aller au-delà de la dispensation des produits à l'officine pour aussi penser à la stratégie de l'auto-injection. Mais le Code de santé publique en l'état ne prévoyait pas cela. Et donc, il a fallu réviser ce Code de santé publique pour prendre en compte tous ces aspects. Et le code a été révisé. Il reste que ça doit être passé devant l'Assemblée nationale maintenant pour être adopté. Et si cela est adopté, je pense que ça ouvre beaucoup d'opportunités pour que, en tout cas, toutes ces stratégies puissent marcher et bien aller de l'avant. Donc, voici un peu ce que je peux dire, en tout cas en matière de stratégie politique et autres. Merci.
Great, and congrats. It's great progress in terms of expanding.
Peut-être que Dr. Chalmain aussi a quelque chose à dire. Dr. Chalmain?
Non, c'est bon. Dr. Tangahire, vous avez tout dit.
Super.
Je pense que c'est bon.
D'accord.
Great, merci beaucoup. Fantastic. Thank you all. Thank you for your questions. Great to hear kind of the interest around different topics. I am going to do a quick wrap up, just sort of highlighting some themes and then some recommendations that we at SEMA have for the field based upon listening to both the country, stakeholders and their issues and needs, and some of the product assessments we've been doing and broader consultations. And I just want to remind everybody, we are going to make the slides available. We will send those out. And the assessments are available on, full assessment summaries are available on our website. And so feel free to go there for more of the detailed versions of these different presentations. A couple of themes that I'll call out. The first one around data. Market data, particularly around consumer information and private sector data. I think something we heard from many of the countries, and it came up as well in product assessments, which is the sort of limited access to really understanding what do consumers want in order to incorporate that into planning, into quantification, into product introduction. And then as well, what's going on in the private sector in terms of pricing, in terms of volume trends. And again, this is what's so necessary for that sort of monitoring system for the countries to be able to see, are they meeting the needs of these communities as effectively as they want? And historically, a lot of the gathering of this data has happened in sort of one-off surveys, done either at facility level or consumer research kind of level. And what SEMA has really been trying to encourage the field to think about, which is what are more routine, cost-effective approaches to gathering this information. So think instead around, can you sort of scrape social platforms for data around consumer trends? Can you integrate, one or two questions into a routine data platform survey tool like PMA 2020? One thing that SEMA has worked with partners to test, which is working with the private sector who have introduced sort of inventory software systems, and can we more routinely gather information around volume trends and pricing via those platforms, which it does look like this works, it's cost effective. And so again, we're really encouraging the field to think about where are these more routine, cost-effective strategies to gather this information and have those trends. Second topic, I think you heard, which is around stewardship. So these, as you heard, countries know where a lot of their issues are, and it's about designing tailored solutions to issues around, maybe it's financing frameworks in terms of how do you create sustainable financing and adequate financing plan? And when there's not enough funding, how do you make sure it's sort of supporting the most vulnerable populations? Maybe it's around pricing frameworks. A number of countries are starting to think about how much can the public sector continue to necessarily subsidize all products for everyone versus having sort of a different approach based on ability and willingness to pay, along with thinking about regulating prices in the private sector. So I think these are the kind of topics that we're starting to hear more and more from countries, and having a local or regional go-to expert sort of hub in order to brainstorm and design solutions, hear what's working in other places, leverage those best practices. I think this is the kind of stewardship that we'd love to see more and more people investing in. And in some places, it may be within the government that this hub exists. In some places, you may want to have sort of a shared economics institute in a region. It could come in different ways, but I think more and more of those solutions, we do realize that countries want to be able to access from their own peers and partners on the ground. Heard a lot of interest around how countries are partnering with the private sector. And I think these are actually 3 countries who seem to have some really good models in terms of engagement of the private sector. This is an observation across, frankly, countries at any income level in terms of a challenge, particularly because the private sector is so fragmented in terms of it's not one agency, it often comes in different, smaller, larger, some are organized, some are not. And so I do think this will be an ongoing sort of challenge, and having each other to sort of share ideas about what do you regulate, where do you co-design policies, how do you engage when there's a fragmented system? And these are the kind of topics that we do hear different countries asking around. And again, I think having a sort of single entity that's helping collate some of these best practices and sharing them, so we don't have to recreate the wheel every time in each country. And then lastly, that sort of heeds our last point, which is there are different solutions for different contexts. And then sometimes I think we hear common issues that require collective action, that it's too hard for one state or one country to necessarily take on. So maybe that is around testing data strategies around consumer information. Maybe that is around some of these sharing of how you engage with private sector. Maybe it's around how are people tackling issues around coordinating procurement, particularly when they're grappling with small volumes. Topics around, does it make sense to have local versus regional manufacturing? And I think our challenge has been there's not a place to bring these issues right now. There isn't sort of a forum or mechanism to elevate and highlight these country issues, which means we run the risk of, continuing a world where these small donors and global buyers are driving the agenda instead of the countries being the ones who are actually highlighting and driving the agenda. So we're really urging the field and kind of trying to promote among stakeholders how to establish that mechanism for those types of conversations. With that, just to say this has been a fantastic opportunity. I hope you have really enjoyed a chance to learn and listen from our country stakeholders who are doing amazing work. As are all of you. There are millions of people who benefit from the work of each and every one of you. And so thank you for everything you do. Thank you for keeping sexual reproductive health as a top priority. Please join us in trying to augment these efforts around strengthening country stewardship. We are grateful for all of you for your partnership. Thank you for your wonderful work and hope to see you all again sometime soon. Thank you.
Merci, au revoir.
Merci, au revoir.
Bye, everyone.
Merci beaucoup.
Merci beaucoup. Au revoir.
Actuellement, tout le comité de sécurisation des produits santé mère et enfants est en train de suivre cette webinaire. On a suspendu les travaux pour suivre ensemble ce webinaire. Merci à vous.
Parfait,
Merci
docteur
beaucoup.
Siri. Bonne...
Au revoir.